Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the osteology of the fibula bone. For general features, the fibula is a long, slender bone located on the lateral side of the leg. Look at this image. This is the tibia here, and this is the fibula. See it on the lateral side of the leg. It runs parallel to the tibia. Unlike the tibia, it primarily serves for muscle attachment and ankle stability rather than weight bearing. It does not serve a weight bearing function. It serves majorly muscle attachment and ankle stability roles. So this is the fibula. You can see the tibia. This is the upper part, this is the lower part, and this is the shaft of the fibula. So site determination. How do you identify the sites of a fibula? Now the head is proximal and expanded. As you can see already from this image, the head is proximal and expanded. See the head, it is proximal and expanded. The lateral malleolus is distal and it projects inferiorly and posteriorly. The lateral malleolus projects inferiorly and posteriorly. You know, the lower end of the tibia forms the medial malleolus, while the lower end of the fibula forms the lateral malleolus that projects downward and posteriorly. The malleolar fossa lies posteriorly. If you look at this, see the malleolar fossa, it lies posteriorly. The malleolar fossa lies posteriorly. The interosseous border faces medially. If the malleolus points downward and backwards, the interosseous border faces medially. That's the correct side. So whenever you pick a fibula or you are asked to specifically identify a fibula, you first of all make sure that the larger expanded part, which you know is the head, is placed proximally, which the more smaller part is placed inferiorly. Then for the lower part, you make sure that the lateral malleolus is distal and is projecting inferiorly and posteriorly. Then you identify the malleolar fossa to make sure that it is facing posteriorly as well. Then the interosseous border facing medially. So if the medial malleolus points downwards and backwards, the interosseous border is going to face medially. So that way you now know if it's the right fibula or it is the left fibula. Now let's look at the upper end of the fibula. The head of the fibula articulates with the lateral condyle of the tibia, forming the proximal tibiofibular joint. The proximal tibiofibular joint. It has a styloid process at the apex. Now look at this image. This is the head of the fibula. Neglecting the neck, just look at this is the head of the fibula. It has an apex of the head of the fibula. It has an articular facet for head of fibula, and when you look at this, we say it has a styloid process which makes up the apex. It's important for muscle attachment. The head of the fibula is important for muscle attachment. Muscles like the biceps femoris, the tendon of the biceps femoris, the fibular collateral ligament of the knee, which is found on the lateral side. Now the neck of the fibula, it is the narrow region below the head. As you can see here, this is the neck. It is the narrow region below the head of the fibula. This narrow region that lies below the head of the fibula, the common peroneal nerve winds around the neck of the fibula. Don't forget this, it's very, very important. The common peroneal nerve, also called the fibular nerve or the common fibular nerve, winds around the neck of the fibula. So in case of any fracture, this nerve can be affected, and this nerve, the common peroneal nerve, supplies the muscles on the anterior compartment of the leg. So whenever there's an injury to this nerve, the muscles of the anterior compartment of the legs are paralyzed. So you will not have foot drop, what we refer to as foot drop, because there's going to be an unopposed plantar flexion of the foot instead of a dorsiflexion. Instead of the foot being in a normal state, there's going to be an unopposed plantar flexion of the foot because of overaction of the posterior leg muscles. Now let's look at the shaft of the fibula. It is triangular in cross section, just like we talked about the tibia. The fibula is also triangular in cross section. It has three borders. it has three surfaces, has three borders and three surfaces. Look at it. We have a posterior border, we have a posterior surface, we have a lateral surface, we have a medial surface, we have a medial crest, which we can regard as the medial border, we have a lateral surface. So these are the surfaces and borders of the fibula. Anterior border, posterior border, interosseous border is sharp, and the mid is referred to as the medial border for attachment of the interosseous membrane. For the surfaces, we have a lateral surface, have a medial surface, and we also have a posterior surface. Now, important muscles, key muscles attached to these surfaces of the fibula. Remember, we said the fibula plays muscle attachment function. So the lateral surface is attachment of the peroneus longus and peroneus brevis muscles. Don't forget, peroneus longus and peroneus brevis muscles on the lateral surface of the fibula. On the medial surface of the fibula, we have attachment of the extensor muscles, like the extensor hallucis longus, which extends the big toe. We have on the posterior surface, we have the attachment of the soleus muscle, the tibialis posterior, as well as the flexor hallucis longus muscle. Now let's look at the lower end of the fibula, the lateral malleolus specifically, because that's the most unique feature of the lower end. It is larger and extends lower than the medial malleolus of the tibia. It is larger and extends more lower than the medial malleolus of the tibia. The key features, like we said earlier, you have the malleolar fossa posteriorly for ligament attachment. We have the articular facet, which allows for attachment of the fibula with the tibia inferiorly, articulates with the talus as well inferiorly. It forms a lateral part of the ankle joint. Remember, we said in our video on the osteology of the tibia that the lower end of the tibia, the lower end of the fibula, as well as the talus together form the ankle joint. So this lower end, which is the lateral malleolus, forms the lateral part of the ankle joint. Now, what are the articulations of the fibula? The fibula participates in three major joints. We have the proximal tibiofibular joint, which is a synovial plane joint. Don't forget, it's a synovial joint. We have a middle tibiofibular joint, which is an interosseous formed through the interosseous membrane. All right. We have a distal tibiofibular joint, which is a fibrous syndesmosis. Proximal tibiofibular joint, middle tibiofibular joint, and distal tibiofibular joint. These are the joints. This is the proximal tibiofibular joint. This is the distal tibiofibular joint, and the interosseous membrane connecting both interosseous borders of the tibia and the fibula. Now let's look at ossification. The primary ossification center of the tibia appears around the 8th week of intrauterine life. It's found at the shaft. We have secondary centers located at the lower end. It appears in the first year of life and fuses approximately within age 15 to 17 years. At the upper end, we also have a secondary ossification center, which appears around age 3 to 4 years and fuses within the ages of 17 to 19 years. So the mnemonic you can use to remember is that fibula grows down first. Do you understand? So because if you look at the lower border, it appears first in the first year of life, while the upper border appears in the third to fourth year of life. So for this reason, you know that the lower end of the fibula starts ossifying first. The ossification centers appear first, and it fuses completely earlier than that of the upper end. So you know that the fibula grows down first. So ossification center appears first at the lower aspect, and it fuses first, while the upper end secondary ossification center appears late and it fuses late. So lower end ossifies before the upper end. Don't forget, it's the lower end of the fibula ossifies before the upper end. Now, what are the clinical correlates? I already mentioned about the common peroneal nerve injury. We said it occurs around the fibular neck. Whenever there is a fracture of the fibular neck, this will lead to foot drop. I will regard this as an unopposed plantar flexion of the foot. There's loss of dorsiflexion, so the foot goes in a plantar flex position. There's also sensory loss over the dorsum of the foot. There's loss of sensation around the skin or the dorsum of the foot, because the skin of this area is also supplied by the common peroneal nerve. We have Pott's fracture. Now this is your common peroneal nerve. This is fracture of the neck of the fibula. So this is what you have. Now we have the Pott's fracture, which involves the lateral malleolus as well as the medial malleolus. Sometimes only the lateral malleolus, sometimes both the lateral and the medial malleolus. So sometimes it is regarded as the bimalleolar fracture. The bimalleolar fracture that occurs where there is fracture of the lateral malleolus of the fibula as well as the medial malleolus of the tibia. This is due to ankle eversion injury. When there's an excessive eversion, maybe in sports, common in sports, when there's an excessive eversion of the ankle joint, this can result in a Pott's fracture. And this is what you have: the lateral malleolus affected, the medial malleolus also affected. And sometimes we can have affectation of the lower end of the tibia as well. So viva tips: whenever you go for a viva or you're going for a viva, certain things you need to know about the osteology of the fibula. Always mention that the common peroneal nerve winds around the neck. It's always mention the nerve relation around the neck. I need to emphasize that it is not a weight-bearing bone. Know the ossification order: starts from down, ends with the upper part, and identify the bone correctly. You should be able to side the fibula between the right and the left fibula. Thank you for watching. Don't forget to subscribe to Osteology Explains Anatomy and turn on the notification button so that whenever I drop a video, you'll be notified. Thank you.